am Dr. Praveen Kumar M, rheumatologist at Daivik Arthritis and Rheumatoid Center, Nagarbavi. In this video, I will explain about what causes the arthritis and what is the timeline of the disease and how we can prevent it. So, the most common question which I encounter when patient comes for a consultation is, why did you get the disease? None of our family members has a disease, but why did I get? So, the exact answer is not very clear, but there is speculation or there is hypothesis that autoimmune diseases as a byproduct of interaction of the genes and environment, so which in turn leads to production of the antibodies. So genes is the one which will inherit it from father and mother. So these genes in the body will be in every cells. So these genes will be we are very dynamic. They will daily undergo mutation or changes in their structure, and also there are a system to maintain the same. So if something happens or a miss happens in the genes, so then that will lead to a formation of antibodies in background of environmental factors. So what are these environmental factors? In present day life, it's the stress, which is the most common thing which precipitates the autoimmune disease. Apart from that, is the smoking and infection with the viruses such as COVID, and there are other viruses which can lead or trigger to the arthritis. So in a background of these environmental factors with the susceptible genes, so there will be production of antibodies. So these what we will test in the blood, like rheumatoid factor or anti-CCP. So once they form, so it will not immediately cause a joint pain. So it will be there stays for at least 3 to 4 years. Then at some point of the time, when there is again the trigger or like a stress, so then lead to symptoms like joint pains, like pain in the hand joints, or it could be in the wrist or elbow, shoulder. So initially it may affect one joint at a time. And usually patient, they will not be aware of these symptoms, and they will go to a local doctor or they will take a painkiller from a medical shop, and the symptoms will resolve. The symptoms may appear in other joints, for example knee or ankle, and one fine day, like when you got a stress or during winter or during any viral infection, so there will be trigger of the symptoms. So that is the point the disease has taken, to say that the disease has taken off, and it will be progressive. If you not get treated at this point, the chances that it will be stay forever in your body. So this is about the timeline of the disease. If not treated at this stage, the disease will remain progressive and it will go for a chronicity. And if at some point of the time later, maybe 5 to 10 years down the symptoms or initiation of the first symptoms, you will get other part of the body get affected. For example, rheumatoid arthritis, the lungs can get affected. They may also have the dryness of eyes, dryness of the mouth, or there may be skin rashes for the legs. So these are the other symptoms which will bother you. So most of the individual will ask about the risk of developing joint pain, especially the one who accompanies the patient. So what I suggest is that definitely there is a risk of developing a arthritis if you are one of your family members, especially the first degree or the second degree of the blood relatives is suffering from a joint pain. You should be very cautious when you develop a simple joint pain or a simple back pain as such. So they should consult a rheumatologist and get evaluated. And they also ask that how can they prevent the occurrence of the disease. So there is no exact answer for that. So I can give you the certain tips which will be helpful for the individuals who are at the risk of developing a joint pain. So one is the regular exercises to maintain your body weight in an ideal position or ideal body weight. So just a brisk walking for about 30 minutes in a day for 1 week is the one of it. So others are adequate sun exposure. Why sun exposure is important? Because sun exposure will lead to a synthesis of vitamin D3, which usually we lack in present life or a present day situation. So vitamin D is very crucial in immunity maintenance. So adequate sun exposure is very important, and having a stress-free life. In present life, there is a lot of tension, expectation, and everyone is busy with their work, seeing, and with the increased screen time, hardly they do exercises. So always you need to avoid the screen time and invest those time in doing your exercises, doing medication, doing relaxation therapy, which in itself will decrease the chances of triggering the autoimmune disease. So other tips are having a healthy food. So food rich in green leafy vegetables, fruits, vegetables and food low in the refined carbohydrates, and avoiding the fast foods, and avoiding a high intake of animal proteins like red meat, chicken, and you can rather choose a fish, which is good for health as such. So these are the tips regarding your diet, exercises, and lifestyle changes which can hamper or development of a new autoimmune disease, especially when you are at the risk. And other most important tip is that stopping smoking. Smoking is known to cause rheumatoid arthritis, and it has been proved in different studies that smoking itself is a risk factor for rheumatoid arthritis. So anyone who is smoking cigarette with a family history of arthritis, there is almost more than 20 times a risk of developing rheumatoid arthritis. So you should stop smoking and start walking. Thank you.